Good morning, afternoon, or evening, depending on when you are joining us. Have you ever experienced that muffled sensation, that irritating itch, or even a dull ache deep within your ear? It is a common complaint, one that often signals the presence of something as simple as built-up earwax, but which can, if left unattended, escalate into the much more uncomfortable territory of an ear infection. Today, we are going to demystify this common problem and reveal how two incredibly simple, widely available ingredients can become your allies in maintaining clear, healthy ears, potentially warding off both stubborn wax and the unwelcome threat of infection. You might even have them in your home right now. Before we dive into the solution, let us understand the challenge. Earwax, or cerumen, is not just a nuisance. It is a natural, protective substance produced by glands in your ear canal. It traps dust, dirt, and other foreign particles, preventing them from reaching the delicate eardrum. It also has antibacterial and antifungal properties, acting as a crucial line of defense. Normally, the jaws movements, like talking and chewing, help propel old wax out of the ear canal naturally. Sometimes, this self-cleaning mechanism can falter. Overproduction of wax, narrow ear canals, hearing aid use, or even the misguided use of cotton swabs can push wax deeper, leading to blockages. When wax accumulates and hardens, it can cause hearing loss, dizziness, ringing in the ears, tinnitus, or that feeling of fullness. More concerning, a dense wax plug can trap moisture and debris, creating an ideal breeding ground for bacteria or fungi, paving the way for a painful ear infection. So, what are these two simple heroes we're talking about? The dynamic duo for ear care are 3% hydrogen peroxide and warm water. These are not exotic elixirs, but everyday staples that, when used correctly and cautiously, can offer significant relief and preventative benefits. Let us walk through the process, step by gentle step, to harness the power of these ingredients. First, gather your supplies. A small, clean bowl, a dropper, often comes with eye drops or nasal sprays. Just make sure it is clean, a soft towel, and a timer if you like. You will also need your 3% hydrogen peroxide, easily found in any pharmacy, and some warm, but not hot, water. It is crucial that the water is body temperature or slightly warmer. Cold water introduced into the ear can cause dizziness. Begin by preparing yourself. Lie down on your side, with the affected ear facing upwards. This position ensures the solution stays in your ear canal. If you are performing this on a child, enlist a helper to keep them still and comfortable. Now, take your 3% hydrogen peroxide. Using the dropper, gently instill about 5 to 10 drops directly into the ear canal. You will likely hear a fizzing, bubbling sound. Do not be alarmed. This is completely normal and signifies the hydrogen peroxide is actively working. Remain in this sideways position for about 5 to 10 minutes, allowing the solution ample time to soften and break down the earwax. You might even feel a slight tickle or warmth. After the waiting period, carefully tilt your head to the side, allowing the liquid to drain out onto the towel you have placed underneath. You may see some dislodged wax along with the liquid, which is a good sign. Next, it is time for the warm water. After waiting a few minutes to allow your ear canal to rest, gently fill the same dropper or a small ear syringe, available at pharmacies, with your body temperature water. While still tilting your head over a basin or towel, carefully and gently squirt the warm water into your ear canal. The idea here is not to blast the water in, but to let it rinse and flush. Repeat this gentle rinsing a few times if necessary, again allowing the water to drain out fully after each flush. The warm water helps to further loosen and wash away any remaining softened wax and residue left by the peroxide. Once you are done, gently dry the outer ear with a soft towel. Resist the urge to poke or insert anything into the ear canal. It is also a good idea to perform this process on one ear at a time, especially if you experience any temporary dizziness. For ongoing maintenance, you might repeat this process once a week or as needed, but always observe how your ears respond. Now, let us explore the science behind why this seemingly simple combination is so effective. Hydrogen peroxide is a mild antiseptic. When it comes into contact with earwax, it causes a chemical reaction. The enzymes in the earwax and skin rapidly break down the hydrogen peroxide into water and oxygen. It is the release of this oxygen that creates the characteristic fizzing and bubbling. This effervescence is not just a sound. It is a physical process that helps to aerate, soften, and break up the dense, sticky earwax into smaller, more manageable pieces. Think of it like tiny jackhammers gently chipping away at a blockage. This mechanical action makes the wax much easier to remove. The subsequent warm water rinse then acts as a gentle, natural flush, washing away the loosened fragments. But how does this help with ear infections? By effectively removing excess earwax, we address a primary factor that can contribute to infections. A buildup of wax can create a moist, dark, and warm environment, a veritable paradise for bacteria and fungi to thrive. When the wax is cleared, the ear canal can breathe, remaining drier and less hospitable to these unwelcome guests. Furthermore, hydrogen peroxide itself possesses mild antimicrobial properties, which can help clean the ear canal surface and potentially inhibit the growth of some pathogens, acting as a preventative measure. It is important to stress that, while this method can help prevent infections by keeping the ear canal clear, it is not a treatment for an active, established ear infection. For true infections with pain, discharge, or fever, a medical professional should always be consulted. As with any home remedy, a few practical tips and common mistakes are worth noting. First, always ensure you are using 3% hydrogen peroxide, the standard over-the-counter solution. Stronger concentrations can be too harsh and potentially damaging. Second, always use warm water, never cold and never excessively hot. Thirdly, patience is key. Do not rush the process and allow the peroxide to work for its full duration. A common mistake people make is using cotton swabs or Q-tips to clean their ears. While they feel satisfying, they often push wax deeper into the ear canal, compacting it and worsening the problem. Another pitfall is ignoring signs of discomfort or pain. If you experience significant pain, discharge, or believe you might have a perforated eardrum, symptoms include sudden, sharp pain, fluid drainage, or hearing loss. Do not attempt this home remedy. Consult a doctor immediately. This method is best for routine earwax management and prevention, not for diagnosing or treating serious medical conditions. And finally, if you have any existing ear conditions, ear tubes, or have recently had ear surgery, consult your doctor before trying any at-home ear cleaning methods. In conclusion, maintaining good ear hygiene does not have to be complicated or require expensive solutions. With just 3% hydrogen peroxide and warm water, you possess a powerful, accessible, and scientifically sound method for safely managing earwax buildup. By understanding how these two humble ingredients work to gently break down and flush out cerumen, you can actively reduce the discomfort of blocked ears and significantly lower the risk of developing secondary infections. Remember, this approach is about thoughtful, gentle care and prevention. Empower yourself with this simple knowledge, but always listen to your body, and do not hesitate to seek professional medical advice if your symptoms persist or worsen. Keep those ears clear and enjoy the world in full, vibrant sound.